to enable them to be who they are destined to be. So you need a support system that ranges from the family, in nuclear family, to the extended family, to the school community, to the neighborhood, the extended family, the community in which the children are growing up, to the national level, and all the way to the global level. And so you find COVID-19 is devastating in many different ways that impact on children. On the economic front, you find as stress levels on parents increase, the capacity to take care of children becomes compromised, stress levels are higher, and so you don't even find an opportunity, or you don't find many instances of positive disciplining taking place. When we keep hearing that the elderly are most impacted by COVID-19, that also touches on children, because most of the time it's the elderly, grandparents and aunts and uncles who are the primary caregivers for children as parents go to work and guardians go to work. You also find one of the earliest and most impactful things we've seen out of the COVID-19 situation is the closure of schools. And this definitely has an impact in terms of interrupting on education of girls and boys across the world. But then for many girls and boys in marginalized communities and in lower income households, this has an even wider impact. A lot of these children rely on school meals to support their daily nutritional needs, so they are no longer able to get that. As the economic pressures mount on households, it's easier to find children being pushed into labor. So you find children having to go to work to substitute or to complement the income that is being brought into the household by parents and guardians, which we also know most of the time that then renders them very vulnerable to abuse. We have specifically girls and boys, and mostly girls, having to bear the additional burden of taking care of sick members of the family and sick members of society, which also predisposes them to contracting the infection as they undertake these roles. You also find older children having to take on the burden of taking care of younger siblings. So there's an extra social and economic burden on children. In worst case scenarios, as a result of negative coping mechanisms, you find girls being forced into commercial sex work. You find girls being pushed into early child marriages. As parents are unable to feed their children, they're likely to end up marrying them off. And when you look at the situation where now you're forcing children who usually have a life outside of the home, being compacted in small places with adults, different adults, dangerous adults, sometimes we also have an increased risk of sexual exploitation and abuse that can impact on the children. And then other than the actual infection, we have a large percentage of children, especially in sub-Saharan Africa, who already have pre-existing conditions. And all the research is telling us that pre-existing conditions render people much more vulnerable to infection. So we have many children who already are HIV positive. We have already children who are being treated or are suffering from malaria. We have TB on in sub-Saharan Africa. We have children who have high levels of malnutrition. So when you look at all these conditions, then it becomes a crisis, and it impacts on children so much that we cannot leave it unattended. And then also you find a lot of people, and I know someone else will tackle this, when you look at a lot of the response, we are looking at health, we are looking at education, but increasingly we are concerned also about mental health and the provision of psychosocial support to help not just children, but also the adults around the children who provide support systems to really deal with this rapidly changing situation. Jennifer, I think I'll leave it at that, and then we can pick up in case there are any questions or contributions that we need to make coming from here.
Mandla, I want you to speak a little bit more about psychosocial support. And then I've seen Angela has just come in, and I would want her to tackle issues to do with online child protection, especially after our experience yesterday. This brings in staying safe to a new, different level. So and Mandla, please, you speak a little bit about you speak a little bit about psychosocial support and the kind of support that we need at this particular time.
Jenny?
Go ahead.
Okay, thank you very much, Jenny. Good afternoon to you, to my fellow panelists, and also your audience. Briefly, I want to talk about the psychosocial mental effects of coronavirus on children. First and foremost, I want to start with the disruption of the children's routine activities. Things like, as you know, the schools are all closed, most countries are going through country lockdown, a lot of clubs, activities, chain gatherings, and services have been suspended. So as a result, almost all children now in Africa are now bored because they are no longer participating in social, emotional, and mental activities. Because children are used to doing activities, and those activities are, I always say that they are social, emotional, and mental activities. And what they do is that they stimulate the children. They do stimulate children. Once children are stimulated, then their growth and development is short. And also, we've seen an introduction of new and unfamiliar social habits. Those habits have got negative effects on social contact. Because, children are social beings, they are used to touching, they are used to playing, children to show affection, So, all of a sudden now to observe social distance, even playing now is restricted. They are no longer playing with their friends, they are not playing in groups. Just being to take away a group of with balls and nice space to that is a coronavirus now to observe social, distancing. So contact playing out an issue. Children can no longer visit their friends and relatives. So as a result, they now got what I call anxiety, because they want to know, what things like what's going on, how will this thing last, and so on and so on. Also, their tensions, they fear uncertain over what the future holds for, especially when it comes to the testing calendar. They were about to for their test and examination, so those things suspended. So that too, stress, anxiety, and depression, because even the school been suspended indefinitely, so nobody knows where they end up writing the exam, what happened to the amount of that put already in this year. And also, there is a lot of information. I would say it's information overloading, because we hear very big tests such as COVID-19, coronavirus. Nobody is explaining that in simpler, simple. So big terms, and that's image. Lot of it is too difficult for children to process and understand. And since they can't understand and process that, so they feel threatened by the risk, of having to be infected, things like that. And also a lot of misconception on social media, for instance. A lot of information, some of which is not true. So that leads to a state of confusion and spam. So that leads to risky behavior. So we talk about that when children are confused, panicking, and they're in despair, are likely to engage in risky behavior, like even to time in their hands. So may vary into substance abuse, things like that. Maybe I now. But Jenny,
Okay. Mandla, we seem to have lost you. Hello, Mandla? We seem to have lost you.
I'm here.
Okay, go on.
I'm here, Jenny. Can you hear me?
Yes, I can hear you.
Hi, Jenny.
Yes, I can hear you. Go ahead.
Okay. Where do you want me to restart?
2 sentences back.
Come in.
Go 2 sentences back. We lost you at some point.
Oh, okay. Yeah, your line is breaking. But then I was talking about the fact that we have a lot of information about the COVID-19, the coronavirus, which is very good. But then I was seeing some of the terms that we use, they are big medical terms that children cannot process and understand. And when they cannot understand or process that information, you know, they overcome the fear. They feel threatened because they do not actually know how this will affect them or what is it that they need to do so that they remain protected. Lastly, I was talking about the information on social media, that there's a lot of it, but most of it's not helping children. Rather, it leads to a state of panic, confusion, and despair. And when children are caught up in that situation, it leads them to engage in risky behavior, like venture into substance use. Others also involve themselves in sexual abuse and exploitation, things like that.
Mandla? Mandla?
Mandla?
Mandla?
Jenny?
Okay.
Hi, Jenny.
You start from risky behavior. We lost you from there.
Okay, thank you. All right, I was saying, while it is true that the information available even on social media, most of it's made of information that is even true. So when children do not get the right information or information, that leads to a sort of panic, confusion, and fear. So when they are in that state of confusion, that may lead to risky behavior. They may engage into, you know, behaviors like substance abuse, others even engaging in sexual abuse and exploitation. I pause there.
I'll go back to Kijala. Kijala, you've spoken about the pandemic being a humanitarian issue. So I'm going to talk, I want you to talk a little bit more, because right now, a report by Save the Children shows that 6 out of the 10 most dangerous countries in Africa, in the world actually, are in Africa. And what does it mean to these children? These children with now, they're already in conflict. And then what does it mean to them now with the COVID-19?
One of the strands of work that Save the Children is advocating for, in alignment with even what the UN has called for, is for a ceasefire on all fronts all over the world. So if you look at Syria, you look at Iraq, you look at different countries on the continent that are in conflict, all this continued conflict is hampering all humanitarian efforts to take medication to these children, to take food to these children, even to deliver education, whether mobile education, education through the radio, and education through different media platforms. So this is why when these countries are in conflict, when you have protracted conflicts of different kinds, then the situation of COVID-19 on children is even made worse, because the social systems don't work, the government systems don't work, you don't have freedom of information and you don't have access to information. Now, a lot of the response is around social distancing. There's a lot of restriction of movement. So what would be really helpful is for governments to have a special dispensation for humanitarian workers, for instance. So state and non-state actors who need to avail critical services to children and communities that are marginalized in refugee camps, communities that are displaced. The efforts at controlling the spread of COVID-19 should not hamper humanitarian work. So children who still need to be immunized should be immunized. Children who are on school feeding programs still need their nutritional intake. Those who are unwell still need their treatment. Children and their caretakers and guardians and parents who have pre-existing conditions still need to be able to access their medication. So Jennifer, that is why we need a complete ceasefire. And even as we have efforts to control COVID-19, we must have special consideration for humanitarian engagement.
Thank you, Kijala. Thank you, Kijala, for that input. And Mandla, I have a background in psychology, and one of the things that we are told is the best way to make children go back to to overcome any kind of psychosocial issues is education. But now we have been told to close schools. So what does that mean to children? How is that impacting children mentally? So what can we do to ensure that there is that continuation of like there's mental health for children?
Thank you, Jennifer. Yes, you are very right. I would know that from preschool of early learning and development education, school is socialization and for any other thing. So school to children is more than just environment where they pursue their academic and so on. It's a place where they meet friends. Some of them even get their own meal from school. So there's a lot that goes on in a school. Now that school activities have been suspended, a lot is at stake. For instance, like I was talking about academic development, that one is most obvious that they are missing their academic learning activities, but also there is also emotional well-being that takes place all child that's in school. So those activities are so like activities, activities, all those activities need those stimulants students in development also lead to them psychosocial so now that it has a suspended those not going on its development as far as academically, socially, emotionally, and was.
Mandla, we missed you. We missed some things there. I think your connection is not very clear. So I think what you're going to do is you're going to type it out for us, and then we can share with the rest of the guys. So Sam, the girl child. I read a report. I read a report today, a very interesting report that during the Ebola virus, there was a spike in teenage pregnancies, and there was a spike in child marriages. So what do you have to say that, especially because I know Plan and their work around, your work around the girl child. So what do you have to say about that, Sam?
Thank you very much, Jennifer, for putting this together. Not sure if you can hear me. I suppose you can. I mean, let me first start by acknowledging the great work you've done in putting this together. I know we've had some challenges, but in spite of the challenges, we are happy we are here to be able to talk about the issues facing children, and particularly issues facing girls. Now, I think some of the earlier panelists have talked about the issue of education. Now, if you realize in most countries, and I think one of our campaigns has to do with keeping girls in school. Now, the reason why we keep girls in school is because it's one of the buffers for ending child marriage and also teenage pregnancy. Now, if girls are in school for 11 hours, 10 hours, 9 hours, whatever it is, I mean, they are learning, they are engaged, they are in school, and that is a buffer, not only for giving them skills and education, but also for preventing them from engaging in activities that results in either get married or also getting pregnant. Now, once you break that cycle, which is what we find ourselves in, lockdowns, schools have been closed, girls are home, boys are home, it is a good recipe, unfortunately, for girls to be involved either in marriage because they're home, they're not doing anything. Parents have lost jobs, they've lost income. What is there for them to do? They can't feed all the children. So obviously, those who had wanted to marry off their girls, for them will be a good time to marry off their girls. Again, because the girls are home, I mean, from morning to evening, most parents probably are working in the fields or they are working wherever they are. Again, that is another opportunity for children to engage in activity that results in teenage pregnancy. So definitely, yes, it is. And that is why we joined the earlier speakers to say, how can we so engage girls and boys in education, whether it's a mobile kind of education, whether it's online education, whether we are using other means, other technologies to get girls engaged. Now, unless we are able to do this, unfortunately, we'll find a situation where more girls become pregnant and more girls are married off because everybody's home and most parents are not in a position to keep an eye on girls. But again, because of the lockdown, I mean, society and community involvement in protecting girls also get diminished because everybody is looking out for their own. I think one of the challenges we have currently is the lockdown, which also, and I'm happy WHO is now calling it physical distancing and not social distancing, because again, what you want is you want a kind of social protection, you want a kind of community protection for girls. And once you get into a situation where you declare a pandemic and almost every part of the society is actually grounded to a halt, then unfortunately, we also realize that some of the protective mechanisms at the community level also get diminished.
Okay, Sam, when you're still at it, I think we need to go issues to do with SRH. One thing that I've seen being discussed a lot is, especially on Twitter and other platforms, is issues to do with contraceptives, issues to do with sanitary towels. Now that shops have closed and sanitary towels have not been categorized as sanitary things, like, you know, like having a sanitizer or soap and everything. What do you have to say about that?
I mean, yes, unfortunately so, Jennifer. I mean, the thing you realize is that the health system, the health services, the health infrastructure, I mean, serve many purposes. And one of the purposes itself is providing sexual and reproductive health rights and services to adolescent girls and girls for that matter. Now, because of the pandemic, almost every country has prioritized COVID-19. I mean, health workers, both retired, active ones have been called, and everybody is supporting that. So unfortunately, we find ourselves in situations where access to those services have been curtailed. Everybody is talking about importation of masks, protective gadgets, and there is very little concentration on importing very basic material that adolescent girls would need. I think the challenge is real. What we need to look at, again, for development workers like ours is to advocate for services that are essential. And I think when we're talking about essential services, in this era, nobody talks about sanitary pads for girls, which for us is very key. Access information also for us is very key. So how do we make sure that, yes, we do respond to the issue of COVID, but also not relegating to the background some of the very basic necessities and, if you wish, materials that girls would need to be able to do what they do normally. And I would say sanitary pads for us is one of the key products that we need to provide for girls.
Thank you so much, Sam. Thank you so much. We're going to go. So I've seen Dr. Dai has just come in, but before he jumps in, I want, considering of what happened yesterday, and it's something that I've read, it's not only happening on Zoom, it's happening on something new that has quite a number of apps that are coming up, like TikTok, House Party, you know, and it's something, it's an emerging thing that has come with coronavirus. So I'm going to put on Angela from Terre des Zones just to speak a little bit more about this. Angela. Angela? Angela? Okay. Okay, I think she's off or she's not around. So Dr. Dai, coronavirus in the context of children. This year we are commemorating 30 years of African Charter on the Rights of Children. And the coronavirus has just hit Agenda 2040 at the back. Like, how are we going to achieve this? The Agenda 2040, Agenda 2063 in the face of this? And like, what can you be able to tell other people in issues to do with child rights? How it's going to impact child rights implementation globally, but specifically for Africa?
Hello, can you hear me?
Yes, I can hear you. We can hear you.
Excellent, and sincere apologies for joining the conversation late. But I think that this time is very important for our continent. A time to raise the profile of children and to recommit to meeting children's rights. Unfortunately for us, all the momentum that we've been building for the last year or so under the CRC seem to be challenged by coronavirus. From where we sit, we see coronavirus affecting us in three ways. First is really life-threatening. What we say, coronavirus affects lives. The second is really it affecting livelihoods, and third is it's affecting lifestyles. So these are the three spaces that the three L's, what we call the three L's: lives, livelihoods, and lifestyles. And that's the impact that coronavirus is having on Africa. And certainly since March 11th, when the pandemic was declared by the World Health Organization, the footprint of coronavirus in Africa continues to increase and continues to spread. What we are expecting, or what the experts are saying, is that the numbers are likely to grow. And as we know, the numbers grow gradually, and then it becomes sudden. So Africa is already seeing the small numbers, and then we anticipate an explosion if nothing is done. So what needs to happen really is what member states are doing. The response to coronavirus must be sudden and then gradual. But the actions, because of the exponential growth, you don't want the coronavirus to hit the tipping point. And when it hits the tipping point, it just spreads like wildfire. So let me land on issues of child rights. and say that coronavirus affects all the rights, but I like to look at it from 5 perspectives, if you allow me. And yesterday in the introduction, a lot more rights were articulated. We should understand that there's the direct effect of coronavirus itself, and there are the effects of coronavirus that arise from the control measures that we put in place. And we know that the control measures are based on physical distancing. People talk of social distancing. I say physical distancing, but remaining socially connected. But physical distancing is one of the measures that we need to think about. And I'll talk about its ramifications downstream. So direct effect of coronavirus is a health issue. It's a public health issue. It's a pandemic. So children's rights, children's health are affected by the virus. The good thing that we know from at least the China and from other cases is that less than about 2 to 3% of children are affected. The impact on children is low. So from that perspective alone, I mean, it's good news for children, but it's still one child too many. So it's health for the children that we need to be looking at. And when we talk about a child, we're looking at the children from 0 to 18, and that creates the differences and the needs that all these children have. But the first response is a health system, public health response. And in that regard, what we need is to keep our children alive, make sure the signs in children are recognized early, make sure the children receive appropriate care, and make sure the children also receive the requisite social distancing opportunities that ensure that they are not exposed to coronavirus. The good news is that within the population profile, the impact of children is lower. But the big effect of coronavirus comes from the social distancing measures, which certainly, or physical distancing measures, which include social isolation or personal isolation. It includes quarantines, but it also includes lockdowns. Lockdowns are for me distancing measures that aim at creating social distancing, and that's where the effects begin to show even bigger. The biggest effect is in disruption of services. Where are our children going to get the critical service that they need? Food, emergency in some situations, water and sanitation, and even immunization services. There are going to be disruptions in services. So disruptions of health services are things that we need to keep an eye on. And the real issue is, how do you kick it off, or how do you reintroduce these services after the lockdown measures? So you are beginning to see the impact on children's health as a result of coronavirus. I must say immediately that in Africa, we need to keep an eye on the impact on children because of the prevalence of malnutrition amongst our children, because of the high prevalence of it's HIV among young people. I mean, these are comorbidities that, in my view, can worsen the impact of coronavirus. So this is something we need to keep an eye on. So one is disruption of health services. The second, which would affect a lot of children, is the disruption of education services. And as you know, most schools are closed. And the impact on children's education is going to be huge. So the African Union and UNICEF have just sent out a note on what to do to ensure continuity of education, even as we create social distancing measures, what to do to monitor progress, and what to do to kickstart education. And the guidance is available, but the impact on education is going to be huge. Now, related to that, and let me know when I'm taking too much time, is the whole issue of children's ability to play and to engage with other children and to grow in safe environments. It's going to be tough for children, not only for children, but also for their parents, and the stresses associated with the social distancing and social isolation is already emerging in our communities. And you know how that makes children even more vulnerable. And that takes me on to the third bit, which is around violence against children. Unfortunately for us, children are the most vulnerable in such environments. The experience from our fight of Ebola showed that violence increases, gender-based violence increases. UNICEF has sent out guidelines, as have other organizations, on how to deal with stress, how to deal with gender-based violence. Let me also talk about the global supply chain. And this is one space that all of us need to keep an eye on. The global supply chain is breaking down. I think most countries have been very dependent on China. Now, the first wave that led to the closure of China has really impacted the global supply chain, as well as, and I'll talk about the last thing, and I'll stop here. Now, the good news is that the supply chain is opening up, and the supplies are coming back with China opening up, but this has been substantively impacted. But at the micro level, the supply chain is going to be even worse. So there's going to be core deprivations in countries and in children that are very vulnerable, which calls on us to be very much aware of a certain group of children. And I'd like to highlight 3 or 4. The first is the urban poor, children without parental care. The second is migrant children. Fourth is those displaced by conflicts. And fifth is the fifth is disabled children. All of us need to come together to target these children with services, and we need to keep an eye on them moving forward. And lastly, we need to be looking at the economy. I think that what is going to happen, and lots of countries are incorporating economic interventions incorporating a lot economic and public health interventions. We need to look at that. And for us, what we as a community need to advocate for as part of the economic intervention is investment in social protection mechanisms that ensure that children in very vulnerable and deprived households have access to social protection mechanisms. So let me conclude by saying that the coronavirus is really going to affect lives and lifestyles, and definitely the livelihoods of the African population. Children are going to be even more vulnerable. But as we look ahead, we see another real challenge, which is a deepening of the digital divide that exists in Africa. Staying socially connected requires that we are able to converse using the internet. What is going to happen to those without access to internet? So we would like to use the opportunity to also say that as we enter into a new space of life where people would be less and less connected physically, be socially connected through the internet, which means we have to come together and advocate for the internet to be a global public good, which we invest in and make sure people have, because that's going to be the platform for learning, the platform for transaction, the platform for engagement. And if people don't have access to it in the short term and in the long term, unfortunately, we are going to deepen the inequalities that exist on our continent. So let me stop here and hand over back to you, Jennifer.
Thank you so much, Eddie. That's very informative. So you've said some very important things. So I'll go back to the economy, and then I ask you this question. So I'm unmuting you so that you can answer the question. So the question is, livelihoods are being lost. I met a lady yesterday or the day before yesterday. I was buying some mangoes, and she told me, Jennifer, you buy a lot. You know, tomorrow they're going to close their shops and will not have. And then she like, you know, like speaking to herself, like, now if they close, what is going to happen to my family? What's going to happen to my children? You know me, I'm just those ladies of hand and mouth. I have to say, I said today I go feed my children. So are you going to on that? And also, if any one of the speakers can be able to delve into that, what's going to happen to livelihood? And you know, livelihood means something that is coming up, something they cannot be able to pay rent. So you can.
Yes, I think the point that the lady and is something that, can you hear me? Sorry.
Yes, and then Sam, you're next. Yeah, yes, I can hear you.
Yes, the point that the lady raised is real, and it's something that, as I have monitored the kinds of interventions that countries are putting in place, I found them to be aimed at mitigating some of those impacts. One is to keep the supply chain moving, so that there can be access to, as we practice what people call social distancing or physical distancing, there should be a measured approach to accessing supplies within the markets. Unfortunately, if you are going to shop from Karioko, I mean, some of the big markets, it's very difficult to practice social distancing in those markets. So there's a need for us to look at measures to create spaces. And in some countries, they're opening up the markets in such a way that the crowding in the markets would be less. But that's the supply chain dimension, and it's going to be affected. But I think that countries are putting in measures to have shops opening, and they're exempting people who sell to come out, because they realize that that's a challenge. There's the other dimension, which is the demand side of the equation, which is funding. Not everybody can stock for 2 weeks or has enough resources to stock for two weeks or 3 weeks. So two things are happening, which I think is great. One is for those who are already working and could immediately become poor when their salaries are cut. Governments are putting in place measures to assure that jobs are protected and salaries are protected. And for us, that's a good measure, because that will continue to, if that does not happen, that is going to continue to increase the population of poor people. But there's another group of people, and these are the groups that sell on the streets. These are the urban poor, these are the rural poor, who do not have anything. And that's a big challenge. I don't pretend that there's a resolution. But for me, as we look at it, it's where we are looking for social solidarity, which is around what the family can support now. But ultimately, it's about putting in real public policies around social protection measures. And this is the time for us to invest in advocating for it, because these ones are going to be poor. And I don't pretend to have solutions to it, but I know it's an issue that collectively we have to advocate for, we have to put our minds to. And if Africa comes out of this, this pandemic standing, for us, we have to invest efforts in reducing vulnerability and in making social protection interventions available to people, in addition to expanding the base and opportunity for jobs. But I would like to listen to others and see what others have on how we deal with the poor and vulnerable people. Over to you, Jennifer.
Sam Nolga, you're next.
Sorry, Jennifer, I can't hear you.
I muted myself. I'm saying when you're answering this question, I want you to answer it in the also add issues to do with child marriage. In Kenya, for example, in Turkana, there's a research that was done that showed that whenever there's drought, there's an increase in child marriage, where parents find it easier to give their children away from marriage instead of them staying home, because it's a less mouth to feed. So when you're doing this on issues to do with livelihood, please add a component of child marriage.
Thank you, Jennifer. I think I would want to start from where Eddie ended, and it's very true. I mean, if you look at the way that the lockdowns have been done in countries, it's literally pushing out the very poor people. And I can give examples from Ghana and other places where it says shops are open, but we also know that the majority of people who sell by the roadside, and they are not allowed to be selling. So obviously, the people we are pushing out of the economic sector are those who live from hand to mouth, and that is a huge part of the informal sector. Now, that informal sector, unfortunately, is the same sector that most of the girls we're talking about and the children do belong to. So on one hand, yes, I do agree we need systems to be able to curb the spread of coronavirus. But on the other hand, the same measure is keeping a lot of women out of work. Now, with diminished incomes, with lots of jobs and job opportunities, what is going to happen is that we're going to have situations where most children are going to be more nourished. Eddie talked about that. And if this goes on for a long time, we're probably going to see not coronavirus killing children, but we're going to see the impact of some of these measures creating situations where mothers are not able to provide for their children. And so we have increased in malnutrition and also on the nutritional status of children, and particularly girls, because in some of the communities we live in, I mean, if there is food to be shared, normally the boys are given the first option, your girls are going to come last. There's also the likelihood of child labor, and especially if mothers are not and parents are not earning enough, especially in the rural areas, and coupled with the fact that girls, I mean, schools are closed at the moment, your next labor are going to be children, and most of them are going to be forced into doing things that adults are supposed to be doing. So I think for us, that is a big worry, which is part of the economic implication of coronavirus. Now, definitely the issue of negative coping mechanisms, not just by the parent, but by the girls themselves, and especially if you're talking about adolescents, I mean, it's going to increase. And so some of those negative coping mechanisms will be around sexual exploitation, will be around other things that girls will do, which would be demeaning. Child marriage does definitely increase in such situations. And like I said earlier on, parents, and because of education, some parents are not marrying off their children because there's something that is occupying them. Now, with girls being home, with income dropping, with social distancing, everybody being locked in, with mothers and parents becoming poorer and poorer. And I hope this doesn't go on for a long time, but if this does go on for a long time, see an upsurge of children being married off, because that will be one of the coping mechanisms by parents who would want to, for a few livestock or for a few dollars, would want to marry their children off. I think what we need to do is to intensify community surveillance, so we don't have parents marrying their children off. We need to intensify our advocacy around information sharing, so children and community systems are able to report where children are being married off. And I think we also need to make sure that, as Eddie said, if there is any government mechanism around safety networks and social protection, this is the time that we need to activate those, clearly identify the vulnerable whose livelihood have been impacted because of some of the lockdown, make sure we register them, and if there is any assistance that needs to be given, make sure that these people are prioritized.
Kijala? Kijala?
Jennifer, I think just to augment what everybody has said, on the social economic front, it really will just come down to what kind of infrastructure government needs to develop around social protection and safety nets. I don't think we can run away from that. So that then while you're doing social distancing, and if it comes down to it, lockdowns, there have to be mechanisms for food distribution, water distribution, continuation of critical and essential services like vaccination, meeting the nutritional needs for children, prevention of sexual exploitation and abuse, criminal justice for, enforced early child marriages, because the coronavirus has not only short-term impacts, but it has generational implications. And so all of us working with children must do everything possible to protect a whole generation of children whose education has been interrupted, nutritional needs have been interrupted, mental health and psychological welfare has been interrupted, education has been interrupted. We're talking about sexual and reproductive health rights, access to services have been interrupted, even dealing with the implications of pre-existing conditions. So I think even as we're talking about the value chains, other than production value chains, it's even just continuation of treatments. Children with pre-existing conditions, malaria, children who are differently abled, children with tuberculosis, children with pneumonia. How are we need everything that we can do possible. And I think in the meantime, it's all development partners and governments and non-state actors to just come together to ensure that these social protection mechanisms are happening. There are different mechanisms that have been developed for mapping most vulnerable members of society. And I think these different modalities and approaches need to be very layered and very precise and ensure that critical services are reaching the most marginalized children first, and bearing in mind the intergenerational dynamics, bearing in mind the gender dynamics. It can only be done through social protection mechanisms in the meantime, and having a different way of thinking. And that is why, even as we are putting in place mechanisms to control the spread, to prevent the spread, humanitarian interventions and humanitarian work must be continued to go on in the informal settlements, in the refugee camps, everywhere where there are marginalized communities. These services must be enabled to continue. Thank you, Jennifer.
Mandla, I hope your connection is good. The psychosocial impact of the economy and the loss of livelihood. And there's something that's coming up right now, toxic stress as a result of parents being at home and they don't know what they are going to feed their children. So what are the strategies are we able to come up with for that? Mandla? Mandla?
Hi, Jennifer.
Did you hear my question?
Yes.
So in livelihoods, what's coming up is questions to do with stress, toxic stress as a result of loss of livelihood, and parents, because they don't know what to do at home. They have so much stress. They have children to feed. They have rents, bills to pay, but they do not know what are the strategies that we can come up with to deal with that.
Jennifer, I'm sorry I couldn't hear your question. I'd like to think that you want me to also say a few words regarding what can be done, short, medium, and long term. So if your question is along that, let me start off by echoing what the others have said, that in this pandemic have short, medium, and long-term impact. And unfortunately, there is very little that we can do now, but the best we can do would be to build the resilience of the children because unfortunately we have no control over what is happening in their lives in as far as this COVID-19 is concerned. So I would start by saying that at home and also in hospitals, let us provide child-friendly space so that the children can process their feelings, thoughts, and emotion. By allowing them or provide those space would be contributing to their social and mental well-being, meaning that if those spaces are there, children would be able to, kind of cope and, build their resilience. Yeah. And then secondly, I think we need to provide a lot of love, care, and protection. In fact, that is what psychosocial support is. So I would like to say that in providing psychosocial support, we need to apply psychosocial approaches to ensure that service provision is holistic, is intersectoral, and integrated to enhance the psychosocial and mental well-being of children. And in as far as the information, because for them to cope and be resilient, they need to get age-appropriate, simple information on what the coronavirus is and what the COVID-19 is. So we can do it by making reference to symptoms that you're familiar with, like flu-like symptoms. When take them from what they already know, and then we can move with them to what they do not know. And in doing that, we have to use simple illustrations like diagrams to show the symptoms and things like that. And also we need to open our ears. We have to listen to what children might have to say, because it's not only us adults who are affected by this and who are so concerned about what will happen to us. Children are equally concerned. So we need to listen to what they might have to tell us. Things like if they are not feeling well, let us pay attention nowadays, because not feeling well may mean that they could be infected or they are worried. And also, when they say they are scared, we need to listen to them and engage them. So by doing that, would be allowing them to express their thoughts, their feelings, emotions. And then we need to emphasize and promote and reinforce the positive behavior, like the washing of hands. Children like washing hands. We just have to keep on encouraging them. These are very simple habits that they adopt. Covering their mouth and knowing when they are coughing or sneezing, including the distancing. I think children, they will pick this much easier than us adults if we emphasize on it. And also saying to them they can still show social connectedness, they can still show affection without really having to kiss someone, to hug or even shake hands. And then school activities so things
we've lost you. We've lost you, Mandla. We've lost you, Mandla. We have lost you. So, but they so we've lost Mandla, but there's a question here. Okay.
I'm here.
Okay. Now you can continue.
Okay, thank you. Yes, so I was saying that now that school activities have been suspended, community activities and children's activities, the root activities that children are so used to and comfortable with, they've since been cancelled. So let us find alternative home-based outdoor activities so that children do not become bored. Because when they are bored, they are likely to engage in many activities like the sexual activities, the substance abuse, things like that. And also, if need be, we need to support children with symptoms to go for testing and also treatment. Yeah, so you can just pause there. Thank you.
Thank you so much, Mandla. There are a number of questions that are coming up, but before we go to questions, let's do the questions because I think they are going to go. There's a question here from Dr. Olumbe. She says, how do we ensure that children have access to play, which is critical for their proper growth and development as a result of reduced social and mental related challenges? I think Mandla has covered that a bit, but is there someone who wants to touch on that?
Maybe I can, because I have a 10-year-old and a 4-year-old in the house. I think it's just finding creative ways of play in simple things. So like one of the things we do is we roll up socks, you line up buckets, and then people try and toss them into the buckets. So I think because we're in a new normal, we all need to adapt and be creative in using what we already have. We have jumping competitions, we do I don't know what you used to call it, the game where you draw on the ground and you do 1 foot, 2 feet, 1 foot. So it's going back to the basics, folding up socks and making them into a ball and trying to hit each other. It's really going back to the games of our childhood before electronics, digital distractions. We really just have to go back to basics and create fun and interactive activities with the resources that we have. Jennifer, you're on mute.
I'm saying, is there anybody else who wants to tackle that question? Okay, Kijala, I have another question for.
You're on mute, I can't hear you. What's the other question?
Okay, let me just pull it up. The question, it's on YouTube because you have quite a number of people watching on YouTube. The question is, it's on humanitarian action. The one is it's from Esther Ngina, and she's asking, how do we creatively provide humanitarian support in lockdowns where the government may not consider non-health staff as essential staff or personnel? This is very important. Like in Kenya, they have said there are kind of people who can go out and there are people who cannot go out. And like yesterday, we had a case of a child who was being beaten, but social workers are not essential staff. So how can we be creative in ensuring that some of these services that are very unique to children continue to be provided, even if we are not essential staff, especially for countries which have total lockdown. And in Kenya, life stops at 3:30. So what happens to how can we be more creative? So Kijalo, you can start, and then the rest of the guys, you can go on.
I think I keep saying in this current pandemic, we all need to extend each other a lot of grace, civil society, government, development partners, because it's not something any of us has dealt with before. It's an infection of its own kind. The rates of infection are so high. There's a lot of panic. Government and all other stakeholders are trying to do what they've seen other people doing. But I also think because it's a situation that none of us has ever dealt with, it's also a blank check for us to keep co-creating new ways of doing things, new methodologies, and new approaches. So for instance, when the government is listing what they consider to be essential services, it's possible that they have a blind spot to children because the understanding is that once you close the schools and the children are at home, they are safe. But there is an opportunity to put together a petition to meet critical ministers to just make a case for why even social workers are essential services. And even just by highlighting the kind of conversation we've had, looking at all the different rights of children that are being impacted now, looking at the needs to provide parents with additional social and economic support, providing parents guidance and their guardians and their children with additional mental health and psychosocial support. I think it's a case that can be built because no government would intentionally set out to hurt its children. So it's continuous sensitization, and also making sure that we have security personnel who are humane, that before you hit an adult, a child, have an understanding of what could have happened. Things do go wrong. And we know that in all our countries where We have curfews and we also have total lockdowns in some situations. None of the social infrastructure has been changed. The transport is the same, the ferry is the same, the road networks are the same, accessibility challenges are the same. So there's just need for a lot of grace and adoption of a human rights approach to everything that we are doing going forward. So that we are not so militaristic, but we look at the human condition and some of the needs that are required. So I think it's for us to keep having these conversations and highlighting where the gaps remain and where the gaps continue to be in the current structures that have been put in place. Thank you. Thank you, Gina. I hope that answers you. Thank you, Jennifer.
Hi, Jennifer. Hi, Jennifer. Hello.
Jennifer, you're on mute.
So the question, are you able to go? Sorry, are you able to try the question?
Yes, I think I do agree to the point of saying that we need to engage government. I mean, on one hand, again, government defines what they feel is essential service and essential sectors of the economy. I do agree with Kijala that we haven't been in a situation where we are forced to do some of the things we are doing. And I think what is essential is for NGOs to have a sit down with government and explain what we do, especially in humanitarian settings. Now, a lot of things do go wrong in the humanitarian setting. The abuses, the sexual exploitation, all of those things do take place there. And if you realize, most of these camps have been supported and manned by staff who are supported and financed through NGOs. So I think we need to engage government. We need to engage relevant line ministries to get them to understand the role of NGOs in all of this sector. I don't think it's all off. I was having a conversation with Eddie and also with Doris UNICEF, State and UNICEF, where we are deciding to write to the AU through the committee, the Joint Committee, to get the AU to make a statement where NGOs working in humanitarian settings are allowed to go and work there. Of course, I mean, there are other issues around protective gear. There are issues around putting our staff in the front line of infection. Now, how do we address that? What measures do we put in place? So again, some of those conversations need to take place. But I think overall, we need to engage government to understand why those sectors need our presence there. But most importantly, again, we need to take responsibility in making sure that as we put our staff in those settings, we don't also expose them to an infection. That is one thing. I think the other thing we need to talk about also is how do NGOs directly support in addressing some of the initiatives that have been put forward by our government. I mean, most governments are calling for private sector support. I mean, sometimes they forget that NGOs also have funding they can use to support. But I think what we need to do, and again, I mean, Plan have just raised a red flag alert for all Plan offices to engage directly in responding to COVID-19. So again, how do NGOs come together? One, around coordination, because again, you don't want everybody going in. So how do we coordinate our activities? And how do we ensure that our support directly benefits children? Sometimes I do agree that governments have programs, but government programs don't always benefit children. So again, how do we provide alternatives if we realize that the government initiatives don't directly support children and make sure we are supporting children, but also caregivers for children who are vulnerable? Eddie talked about the category of vulnerable children. I wouldn't want to go back to that. But I think we should have a process in place to be able to identify children from very very vulnerable and marginalized communities and families and be able to directly support them. Thank you, Jennifer.
There's a question here, and I think this one was directed to Dr. Day, and I'm glad he's back. The question is, and by Sam who is also Samuel Munyweni, who is also in this call, is there a need to consider cultural factors in making both the choice of effective prevention interventions and in reviewing effects of measures such as social distancing? Because culture. Like the other day, I was helping in hand washing, and this guy asked me, in our culture, we just don't wash hands. You wash hands when you are eating. So that it's when you say washing hands, social distancing, it's something quote unquote an African. So how do we come with this preventive factor and be trying to become cultural sensitive to the people, and especially even children, especially if you're a child who has been brought up in this kind of culture where you need to be touched by your grandmother, you have to greet someone, or you have to hug, or you have to kiss. How do we start going against this cultural accepted behavior to something very different?
You want me to go? I think you're still muted.
Okay.
Okay, Eddie, go. I'll come after you, please.
Okay. Thanks. I think it's a valid question, but as I said, coronavirus is going to change our lives, our livelihoods, and our lifestyles. And the most painful thing about the virus is the physical distancing, which sometimes translates into the social distancing. If you want to help yourselves and you want to help your people, you have to stay away. What we know is that you start transmitting the virus even before you become sick. And others also start transmitting it even before they become sick. So there's a price to pay in being together and ignoring what we know is a clear public health intervention that works. So I know about the culture. I recall when Ebola started, that's when I lost my auntie. And all of us had a conversation about what we do, because part of our tradition in my hometown where I come from is that you have to shake hands, but you don't have to, because if you do, you end up really killing yourselves and killing other people. So somehow or the other, my sense is that this is the time for us to heed to good, sensible public health advice. The selfishness in us means that we have to stay away, because if we don't, we'll kill ourselves and we'll kill our grandmothers, we'll kill our grandfathers. So I hear this issue of culture around social distance. My advice is a technical one, it's a public health one, but it also means that we have to explore other ways of getting together, and there are new ways emerging. A colleague gave me a call recently and was talking about having a party online. We have to evolve new ways that can keep us alive. We cannot afford to kill our grandmothers. The love you need to show to your grandma, going to hug her, might be the death sentence. In terms of hand washing, I think that I don't know what is cultural about hand washing only when you eat. I mean, I think the advice is very clear. The challenge we have today on our continent is that people just don't have access to water. They don't have, some people can't even afford soap. I mean, you go around and you ask yourself, how do you implement this hand washing? And some people have to walk long distances to get water. So we have more practical challenges around the hand washing and use of sanitizer. It's not easily accessible, but that's the context within which we operate. And already I'm seeing some interesting innovations that are happening in some countries, in some communities, where people are making gallons with water, hanging them on strings and stepping on them and using them to wash hands. My sense is that those of us on the ground need to look at these innovations and explore and indeed exploit how we can make them mainstream, because these are not these are trying times. These are not the times that we have the luxury of not heeding to sensible public health advice. They are real unusual times, difficult times. So my advice to my colleagues and to ourselves is, let's stay at home. Let's practice as physical distancing. Let's make the investment now so that we can go back to what we think is the norm, which is shaking hands and hugging each other and kissing each other. These are just not the times. Over to you, Sam.
I mean, thank you very much. I think you've probably taken the win out of the sail, but that's fine. I think I do agree with you on everything you've said. Now, a couple of things I would want to add. One of them is to intensify our education. I do agree with you, we are not in normal times, and when you get out of normal times, you do things that are not normal. And so we all agree that we have to keep to common sense. Now, when you get coronavirus, it's not just you, it's everybody about you. And I think if we really care about the people around us, then we'll also realize that some of these practical measures are only meant to make everybody safe. So let's wash our hands, let's keep distances. I think in communities, and I saw that yesterday in Addis, where there's community provision of water and soap. So even for people who don't have soap, you're walking by and then they ask you, come wash your hands. I think we need to support some of these initiatives, and especially for NGOs that work in communities where people have to walk several distances to get access to water, or where you don't have things like soap and sanitizers. I mean, those are some of the very practical things we can be involved in and supporting. Now, I mean, coronavirus definitely, like Eddie said, have changed everything about us, have changed the way we respond, and have changed the way we have to. I have a friend who traveled recently, went back home, and he has to self-isolate for 2 weeks. He has little children who are all looking at him to come hug him. But again, I mean, they had, before he arrived, they were told that is coming, but this is what we need to do. So it's really painful. I mean, we come to the office and we use our feet to knock each other's knees and some of those things. I think if we, and I don't see this going on for a long time, so let's keep the common sense things, let's keep safe, and at the end of the tunnel, we'll get back to all the things we do. I think the other thing we also have to look at is how do we support very vulnerable people, and sometimes it might just be our own personal initiative. So again, how do we, from our own initiative, support people, our family members back home, people we know who are not in a position to be able to protect themselves? Because like everybody says, you might keep all the distances, you might do whatever you have to do, but it might be somebody else who would bring it to you. So again, how do we support each other? How do we support the vulnerable to make sure that we are not only keeping safe, but they themselves are also being safe, and in a sense, everybody else gets protected.
There's a question here, which I'm hoping this is Angela Nyamu, who is online. So there's a question here by Antenna. He's asking, and I think this question goes to almost all of us, and it's asking the risk of schools closure is increasing the exposure to risk of bullying, cyberbullying, or child abuse on the internet, as children are mostly online without proper cyber security in place. And that is real to us. Yesterday was horrific. So what are the steps that we can start taking right now? Because it's a new world. It's a new world of cyber. So Angela, I'm going to let you on to talk a little bit, and then the rest of us can be able to join in. And then Samuel Munyunyi, you can be able to talk a little bit, because I know you do some work around that. And then let's just talk about online, and because this is a new form of cyber abuse. So Angela, it's not Angela, sorry. It's not Angela. So Sam, Sam, you can talk, Munyunyi, so you can talk a little bit about cyber, this new form of cyber, because like there's TikTok, which every young person has. There's what you are telling us about the house party. You know, it's a new app for where children are going on there and they're having party online, they're having all these things online. How can we safeguard children during this season and to ensure that our children are safe? because these are the same tools they're using for learning. You know, Zoom has a very amazing tool for children to go to class, but you can see if they're being bombarded with all this kind of stuff, how can you keep children more safe?
Well, thanks, Jennifer. I think for most households that are able to access internet or Wi-Fi, there's a great temptation to just allow the children to keep busy on that. But I think there are certain basics of communication within a household that will have to be adhered to at this moment, especially that you can't leave the kids to just do things on their own. I think the lockdown somehow should benefit us by allowing us to engage more with the children in knowing what are they doing. If we can engage, first of all, have those same rules if you ever had or if never had, set some rules and know just how much time are we going to spend online, and as much of those times can we do it together with the children. Again, encourage more outdoor activity so that children are not only doing this. If you've never had a situation where children are able to communicate their feelings and their experiences, then there's a big risk that they are likely to hide in their bedrooms or do something that are going to put them at risk of online bullying or online sexual exploitation. So really opening up channels for conversation. What are you experiencing? How do you feel? Have you come across anything new? Will be very critical. So I think I would want to encourage families and even whatever we are sharing online to be something that we can do together as families. Over to you, Jennifer.
Hi, Jennifer.
Hi, you can go next, Sam.
Yes, I do definitely agree with Sam. I think if there's any positive thing about the lockdown is the fact that parents are able to stay home with their children. And I think that for me is a great opportunity most parents have never had. All of us are really busy. We get home when they are all sleeping, we leave home when they are still sleeping. I mean, we've never. So I think parents should take advantage. I'm not sure how many days, weeks, months are the lockdown in various countries, but we should be able to encourage parents to sit down with their children. I mean, if parents are home with their children, I expect children to be less on their gadgets because that is time for family to talk. That has been the challenge for us as parents. So again, how do we engage our children? They are our own children. Sometimes you have no idea how to engage them. You have parents asking, how do I play with my children? I think it's something we need to learn. It's a new reality that we need to come to. So for me, one, as parents, we need to take personal responsibility. We need to know what our children are doing, but I think it's a huge opportunity for family times where families come together. Kitela was talking about playing with the kids on all those. I think we have a huge opportunity as parents to be able to do that. Now, unless as parents we are not in a position to engage our children, then that is where we have our children going. Of course, bullying on cyber spaces would always be there. We also need to teach our children where and how to move out of those spaces. So again, it's not just one approach, but I think it's a multifaceted approach where we are teaching our children which spaces are safe. We are engaging and directing and guiding them, but also we are teaching them to be able to come out of those spaces if those spaces are not safe for them. But also we need to teach our own children not to be bullied themselves. Sometimes they end up being influenced by what they see and hear and the engaging of those spaces. So again, in as much as we are talking about our children and other children, being bullied on those spaces, I think it's also important that we teach our own children not to be bullies. I know most schools or some schools have protocols and they have commitments around bullying where children are assigned to. I think we should be able to also have that in our families where our children, our children are taught to know that bullying, harassing, all of those are not what they have to do. We need to have some personal principles in our own family. And if every family gets that, I think we'll probably have a much safer internet space. So that is what I would want to say. But I think definitely the lockdown for me is a good and a huge opportunity most parents have never had and which they will never have if this period goes over. Thank you.
Jennifer.
Okay, go ahead, Eddie.
Okay, good. Thanks. I'd like to complement what others have said from another perspective, and for me, the more I reflect on what is happening to us in Africa today, the more I see that there are some actions that we need to accelerate if we really want to be part of what I call the global village. Essentially, access to internet is going to be the norm. And we have to recognize that some people even are beginning to say that they're going to be part of Maslow's hierarchy, and they are going to be the base of Maslow's hierarchy. For some of us, when you go somewhere, the first question you ask is, do you have internet access? So for me, I'm really excited about the work that the African Union is pushing, which they call DOTS. D for digital connectivity of schools. Why is it that our children are going to school and yet they don't have digital connectivity? O is for online learning. I think we as a continent must take the idea of online learning seriously, continuous learning seriously, to complement offline learning in classrooms. T is for teachers as facilitators, and that's where I want to link up very clearly with what Sam is saying. We have delegated as families and as parents the responsibility for teaching to teachers. No, we have a core responsibility to motivate our children to learn, to help them learn. So how do we bring the core family, the core father, the core mother into this space to facilitate learning of our children? But S is where the question I link up with the question. And the S is really about safety. We've invested quite a lot in safety in schools, but really what is happening today is that as children move forward, they all have mobile phones, some of them have iPads, some of them have laptops. They are linked onto the internet. Safety online child exploitation, child sexual exploitation is a real threat in Africa today. So my complementary message is that we need as a community to advocate for that. We know what to do. There are technologies for doing that. There are ways of protecting which we can take forward as a community. So I want to put this on the agenda, on our agenda, as we move beyond COVID. And let me just conclude by adding the other S, which is more skills-based. The focus on skills helps us to empower our children, help them acquire the relevant skills for the future. And so let me stop here and say that as we move forward, we need to invest in it. But COVID is exposing us in terms of the weaknesses in our systems today. And we need to learn from it, and we need to plan to bridge these gaps, which are going to become norms in Africa. Over to you, Jennifer.
As we are winding up, there's a question that as we give our closing remarks, I want us to talk about this. Gloria has asked a question about the family. I'm trying to find that question. Where did it go? Okay, on issues that, but I think we have covered this is in issues of where many families are hungry and they cannot cope with that. How can we protect children with an increase of abuse? Like I was reading a report from the States where since the lockdown in America, and I think also in China, there's been an increase in abuse in children. In terms of neglect, in terms of like just spanking and corporal punishment, and also an exposure to violence, where children are being exposed to violence. Like we just got a report today morning where a girl, the parents were fighting and she went to tell them, please, mommy and daddy, stop fighting. We are at home. Why are you fighting? And she was beaten by both parents because of telling them to stop fighting. So she was experiencing violence and then she got violated herself. So how can you deal with this? Because this is a reality. Lockdown is, you're telling us family to come together, but there's some things which are not really, really good. So what can we do? And as we do that, I also, when finishing up answering that question, please wind up by what are the actions that need to be taken now, before we get to where America and Italy is. What are the actions that needs to be taken right now? Eddie, and then Sam, and then Kijala, and then Mandla.
My first response, my serious recommendation is physical distancing. We need to live so that we can confront the challenges in Africa. We need to protect ourselves, and we need to protect our families, particularly our grandmothers and our grandfathers. So social distancing is the first. Second is, within this landscape, we need to invest in trying to help families come together. So one thing that I think at the community level we can start thinking about is, what are some of the helplines that are available that families can call on for help? I don't think that we have that as yet, and I would like to see that happening. Thirdly, where internet is available, and I think internet access is improving, we need to be socially connected. If we are not socially connected, we are going to really run into problems, because social distancing is very stressful. But as we go through, and as we as a community continue to pay the price of COVID, we need to prepare to launch Africa forward. That is the next, really, we need to be thinking about post-COVID as we survive through COVID. And that is about reopening schools. That's about dealing with some of the things that we have talked about. So those will be my 4 take-home message. Let's really look at COVID and let's respond to COVID. Let's be physically separated. Let's provide ourselves with support systems. But let's prepare to launch ourselves forward post-COVID. Over to you, Jennifer.
Sam and Olga.
Thank you very much. I think I would want to follow through from what Eddie said. The first one for me is, I think we need as families to be families. I always say that, and I think Eddie said it rightly, we cannot relegate the responsibility of parenting to teachers. And I think as parents, we need to go back to the basics and make sure that the social distancing, the physical distancing doesn't break our families apart. We need to use this opportunity to strengthen family bonds. We need to use this opportunity to do things we haven't done in the past and make sure we are improving our home environment. So that is for the home. I think in terms of government, we need very clear policies that recognize the work of NGOs, especially in the humanitarian sector, where government will be supportive of the work NGOs are doing in the humanitarian sector and provide the necessary support. I think this is not happening in most countries. And so the lockdown has locked down everyone. And I think, as we said on this discussion, a lot of abuses do take place in humanitarian settings, including a surge in child marriage and other physical abuses. So that I would want to propose as an organization. I think we would also need to involve children in decisions around them and decisions about them. Sometimes we make decisions for children. Somebody talks about playing and playing areas, some of those things. I think it will be important to involve children in some of the decisions, and especially also in the digital space. On one hand, we are supposed to guide them. On the other hand, we are also supposed to allow them to be able to engage in what it is, what time is moving on with. So I think it will be important that children are involved and that we are not directly speaking at children. I mean, the economic impact of COVID is very real. I mean, it's scary if you look at what the impact have been. I was talking to a friend of mine in Kenya who is a manager in one of the hotels. She told me 90% of all their staff are laid off. So, I mean, it's really scary, and it's important that we devise safety net, social protection mechanisms especially for the very vulnerable. There are families where they cannot have the extra shilling or dollar or bill, whatever you call it, for the next meal if they are not on the street or if they're not in the market. So what are we doing as NGOs? How are we supporting government? And again, what are the specific government initiatives that support people who have been made vulnerable because of COVID and also because of the policies we put in place? I think it will be important, for us as an organization, talking about sexual reproductive health rights, also for sanitary pads to be made essential goods where government pays attention to. So we would want to advocate for that. We would also want to look at how the AU itself integrates some of the learners across the various countries. Various countries seem to be doing different things. Some countries have locked down, other countries like Ethiopia. Thankfully, we have not been locked down. We are still free to walk about and do whatever we want to do. But again, is there an approach that the whole continent will be able to adopt in terms of addressing COVID-19? But finally, I would want to say that we need to practice all the common sense things. We need to live and we need others to live for us. So hand washing, sanitizing, distancing, self-isolation, all of these are meant for our good. Sometimes they seem unpleasant. Like Eddie said, there's no culture that tells us not to wash our hands. So I think we need to practice that and make sure we are safe, not just for ourselves, but for our families and also for the countries where we come from. Thank you very much, Jennifer.
Thank you, Sam. Kijala, as you finish up, I also want you, there's a question about refugee children. So how we take in consideration issues to do with children living in the camps, in the refugee camps, to ensure that they are also safeguarded, because coronavirus does not discriminate. If the Queen has it, everybody's gonna have it. So what are we doing to safeguard children in refugee settings?
Thanks, Jennifer. I think I'll just combine both questions in terms of my final thoughts. I think the first one is just going back to the ideation that coronavirus is a threat on the continent. It threatens an entire generation of children, which contradicts the Sustainable Development Goals. It defeats the aspirations of Agenda 2063. It defeats all the youthful aspirations of all our different countries in terms of the programming and the ambitions that we have for our young people. Africa has always boasted of having a very youthful generation. We have the perfect recipe for what the future would look like. And so this generation must be protected at all costs. And so we're coming back to issues of ensuring nutritional requirements are met so that we have our children growing up in the ways that they should be, having everything that they are having. We need to protect children from sexual exploitation and abuse, even as we are combating coronavirus. We've talked about putting in place social protection mechanisms and safety nets that cannot be gainsaid. Finding alternatives for education and ensuring immediate resumption of education. Issues around vaccination cannot be gainsaid. I think the second issue is around, and this will touch on the question around support to refugee children. All access to essential services and humanitarian support must be allowed. How we negotiate this, with whom we negotiate this, that can be discussed, but all access must be allowed. So for people who are working in refugee camps, they must be allowed to continue providing healthcare. They must be allowed to continue providing food, water, everything that is required. I don't even think we can negotiate on that, because these are the most vulnerable and marginalized children. In the informal settlements, as we are having movement restrictions and lockdowns, we must have targeted responses to provide food. A lot of our children were depending on school feeding programs. How are we going to find alternative ways of doing that? There are different approaches that have been used with the hunger safety nets. How can we layer all these different vulnerability mapping tools to reach the most vulnerable people? So access to essential services and humanitarian support cannot be neglected. And then finally, even as we look at the physical needs, and maybe mental needs, education, and healthcare. They keep saying that it is the stress and the fear of coronavirus that kills people even more than the disease. Because even when you get an infection, you only need medication when it's at a very extreme stage, or if there are pre-existing conditions. But the stress and worry of where to get money from, how to feed children, what the future holds, that is actually what is exacerbating the situation right now. So we need integrated approaches that look at physical needs, psychological needs, mental health issues, provision of psychosocial support. So which health lines are available, even as we are looking at media and medical professions as essential services, where do we place social workers? So renegotiating some of what we think are priorities in light of what the reality on the ground is showing us. Because of stress, we are having more negative disciplinary action. Like you're saying, when a parent is stressed and a child is trying to engage you, you reach out and you smack them. You have increased domestic violence, which then tells us if we don't sort out the psychosocial issues, if we don't provide psychosocial support, even without getting the COVID-19 infection, our families and our societies will not survive this. There's already been a lot of inequality, a lot of economic pressures on families. And if we don't deal with this, it can just make the situation worse. And when families are not functional, when societies are not functional, children are put even more at risk. So we must ensure integrated approaches that also have mental health and psychosocial support in place. And I think increasingly also creating platforms like the one we've just enjoyed right now, Jennifer, but having somewhere we can hear children speaking for themselves and with each other. So I think that is the next frontier, even as we advance child participation, that how we are speaking now for and on behalf of children and advocating with them, but how much more powerful would it be if we had children speaking with each other and on behalf of their own interests and saying how this is impacting them. Maybe they have great ideas on how they can be supported and what we could do differently. Many times adults, we are stuck in boxes, we are stuck on how we've always done things, what we usually do. But maybe it's time to really listen to the next generation. This could really be their moment because their minds are fresh and they could give us different perspectives. Thank you, Jennifer.
Thank you, Kijalia. Thank you so much. That last point about child participation, we are organizing a children to children webinar coming soon.
Thank you.
So we are having one. I've reached out to a number of people, to a number of children, so that we're going to have a, if not this week, early next week, but it's because of safeguarding, we need, you need to call safeguarding measures for children online. So and also you have said something very interesting, and there's a question here about children, informal settlements. Mandla, you start and then Mandla can go on. We are talking about social distancing, and especially for children, but how can they social distance when it's just a curtain or a cardboard or just a piece of metal or a sheet? So how can we ensure that there's this social distancing, and then just safeguarding these children, how can we safeguard children, this social distancing, how can we make a reality to informal settlements, which are all over Africa? So how can we make them more real?
I think it goes back to the 3 L's, that we need a change of lives, lifestyle. This disease has come to change our lives, lifestyles, and livelihoods. It all just comes down to working with what we have, working within our realities. So even where you have a smaller space, you have just a curtain in terms of separation, we could find out from different institutions, different organizations are setting up temporary medical facilities. Even within the camps, I have seen different organizations, including Save the Children, setting up isolation tents and rooms. So it's finding out those spaces. But even within our own family environments, it's just letting in, opening the door, allowing children some supervised time outside while maintaining the social distancing, trying to wash hands within the limitations that we have, coughing and sneezing the right way. So there are things even within our limitations that we are able to do, and I think we must do them. I think the cost of not following the requirements becomes very high. And I find like this situation really calls on all of us to be even more creative than we have been, and really question what can we do within our environments, within our limitations, within our available resources. So it's very easy to keep saying it's not possible, but even in those environments, it is possible to exercise the right Jennifer, I think you're on mute. Did you hear me?
So I think we lost you at some point. The last two sentences.
Also, I was saying we really need to work with what we have, and undo a lot of socialization and traditions and cultures that we have in our minds. So even within our limitations, within the spaces that we have in our homes, we can create those safeguards. Sneeze the right way, cough the right way, hygiene to the highest standard possible. But I also think COVID-19 gives us an opportunity to have what we would consider in many of our cultures uncomfortable situations around boundaries between children and the adults who are taking care of them. Conversations around good touch and bad touch, conversations around permitted levels of proximities, clarity around who is taking care of children, and also giving children very clear lines of communication in terms of if violation occurs, who can you speak to? What does violation? Usually when we talk to our children about threats to their safety, we talk to them about strangers. But research has shown many times 60% of predators and people who abuse children are people close to the children. So if those conversations can be held, uncomfortable conversations, difficult conversations, that is one of the approaches that we are going to have. And I think on this call, we are all emphasizing now that as the parents we are home, can we parent? Now that as the guardians we are home, can we provide guidance and love and protection so that we don't take anything for granted? And I think the final thing is, even with the social distancing, making use of already pre-existing setups, merry-go-rounds and chamas and family groups and church groups, continuing with some of those associations still online, having those conversations where adults and guardians and parents can have conversations that help them to relieve stress, where they can exchange ideas, where they can find different modalities of investing together, forming cooperative societies. All this while trying to take advantage of the situation and still utilize digital platforms, because physical meetings are not really possible anymore. So it's really an opportunity for us to have those difficult conversations and just unlearn a lot of things that we have learned growing up. Like the insistence on handshakes, it's good under normal circumstances. It's a killer move right now. Thank you, Jennifer.
Thank you, Kijala. Mandla, your last point, and talking about issues to do with mental health in terms of how can parents start now giving values? What Kijala said, it's time for us to start parenting. So how can we start this time? We're being given it's been projected until June. Others are saying until November. Whatever amount of time we're being given, because I think we have been given this time, what kind of values can we start impacting on our children from now on?
Hi, Jennifer. I'm sorry, I can't hear you. but I see that you have unmuted my microphone, so you are talking to me. Just to echo what the yes. Let me go ahead. Just to echo what the previous speakers have in terms of what we need to do in this emergency, because as you know, the world over was never prepared for this, so we have to come up with an emergency response. I think that one all of drilling into promoting self-connectedness. So self-distancing is somehow working against that. But I think with the use of ICT, we can still do that. And again, I think children are capable of coming up with innovative ways of ensuring the social distancing. So I think let us engage them and ask them to come up with whatever they think they can come up with. Children are very innovative, so I believe in them. So if the message is very clear to them, I'm sure they will come up with innovative way of maintaining social connectedness, even though there is a social distancing. And also we need to do a lot of conversations. Again, that has to be done because we cannot be meeting in groups now. So I think with families, we need to do a lot of conversation around what we can do in terms of the safety and the precautions. Also, we need to target community leaders, traditional leaders, those who are very influential, to say to them what can be done to ensure that children remain safe during this pandemic. Then children who've got relatives, parents, friends, and whosoever who is like isolated or who is in, being quarantined or who's receiving treatment, what do we do for those children? We need to provide what we call psychological first aid. We need to prepare them so that psychologically they are prepared, so that they understand what their relatives or their parents are going through, and the children themselves are somehow prepared for that situation. And then with government, I like what Save the Children have said with regards to child protection. Government, I think all of them nowadays, they are responding very quickly in terms of coming up with regulations. So I think we need to be talking to government to say, how do you come up with regulations that will help us deal with this pandemic? I think COVID-19 requires us to change our social habits. So we need to use ICT again to come up with those clear messages to say what we need to do to change our social habits, and also to change our attitudes, and probably adopt, new way of doing things. Like the colleagues were talking about the online parties, the online social connectedness, the online thing, and so on. So I think even though we are in an emergency, somehow we are going to learn and adopt new ways of doing things. Thank you.
Thank you so much, Mandla, and thank you, everyone. I really, really appreciate so that you can say bye to each other. I'm going to unmute all of you so you can say bye to each other. But thank you so much for joining in, and apologies again for yesterday. It was beyond my control, but thank you so much. We are going to have another one for children's, because what Fidela said, we need to hear children's voices. We are going to have one very, very soon. So you can say bye to each other. I've unmuted all of you.
Bye. Thank you, guys.
Bye. Bye. Thank you.
Bye.
The link is available on YouTube. You can share.
Hi, Udase.
Hi, good evening.
Good evening, Udase. How are you?
I'm good. How are you?
Okay, so we are going to, the link is going to be available on YouTube, so you can share with your colleagues.
Bye, Jennifer. Let's talk about the case webinar at some point.
Okay.